pelvic floor muscle training before prostatectomy? Let's talk about it. 80% of men who have a radical prostatectomy, that's where they completely surgically remove the prostate, will have urinary incontinence. But it doesn't have to stay that way. This was a really well done study. We had a control group, there was a treatment group. The treatment group received 5 weeks of pelvic floor muscle training prior to the surgery, 12 weeks of pelvic floor muscle training after the surgery. And surprise, the treatment group got better significantly faster with significantly less urinary incontinence and significantly more satisfaction. With a prostatectomy, or a radical prostatectomy specifically, they remove the prostate and along with that the prostatic urethra. And then the surgeon will connect the bladder to the lower part of the urethra here. Because you lose that portion of the prostatic urethra, just the trauma of the surgery, that is what leads to the urinary incontinence. But there are tons of studies that show that pelvic floor muscle training helps improve outcomes. If you need to have a prostate surgery, start pelvic floor PT soon. The sooner the better. I often see guys that have had their surgery 2 or 3 years ago, and that doesn't mean that we can't help those people get more continent. But those guys that we see right after surgery, or preferably even before surgery, get better so much faster. And it's not just Kegels. You gotta load those tissues. Load those tissues, you gotta use the hips and the core. Breath control and pressure management play a huge role. Bladder retraining. If you are experiencing prostate issues, whether it is prostate cancer or other things that require the prostate to be removed, go see your pelvic PT right there. That's where you find one closest to you.